We are honored to speak with Deb Hamilton today, who is a critical care nurse in the ICU at a large teaching hospital in Vancouver. And as we all know, that Vancouver, we've been pretty lucky with low numbers. And we want to hear from Deb what the environment is like where she works.
Thank you for having me. The hospital, I have to say, where I work is not overwhelmed with COVID patients at the moment. We are giving critical care treatment to people who need it, as well as to the patients who are suffering from the disease, the virus. There's a really good atmosphere of teamwork and a feeling that we are making a difference in people's lives, and that we are there to meet their most basic needs. The sad part is that they're not allowed to see their families for more than an hour a day in the regular ICU, and in the COVID unit, they are not allowed to see their families at all in person. But we do use the iPad, and we have phones, and we have walkie-talkies, and we are able to reach families that way. Most of the patients who are in the COVID unit are not intubated, but with a breathing tube, which means that they can speak, but frankly, they're so short of breath that it's very difficult for them to have any kind of meaningful, long conversation with families when they're in the critical period. But otherwise, we have been inundated with food and messages of hope and support, and we hear the ambulance and the police drivers and anybody with a siren every night at 7 o'clock. And it really helps us to stay motivated. The patients even hear it through the glass, and they know what time of night it is, and they know that people are really caring for them and caring for us. And the food in particular is so appreciated from the restaurants and from the community. We've even had Girl Guide cookies dropped off, and my family have donated Girl Guide cookies as well. And it's been very, very helpful to keep us motivated and keep us strong.
Do you feel, and do your colleagues feel like you have enough of the personal protective equipment and the right type of personal protective equipment?
Good question. So far, so good. We've had really good eye protection, and we've got lots of N95 masks, and many of the nurses have been fitted with, we've all been fitted with reusable masks that you see. They have different names, so I won't name them, but they come with cartridges. We're short of those cartridges, but those are not a replacement for the N95. That just means that we can use them again. There's even plans to recycle the N95, so when we take them off, we put them in a bin, and somebody is going to have the magic solution to be able to clean them and reuse them. We have lots of gowns, and gloves are never a problem. So far, so good. And I was surprised, you always see these donations from China. They're talking about donations from China, and I've actually seen the boxes that say donations from China. And they're the actual N95 mask, they're the right goggles that we wear. It's like, wow, the world really is small. Like, this is working. This is the chain of delivery is working to get us the equipment that we need.
That's so nice.
So good.
Because we donated to them.
Yeah, isn't it great that they're sending it back again and more?
Yeah, nice.
So I think it'll last for a long time, and my manager is telling me that we have a lot of PPE that will last us a long time. Mind you, when we're in the regular ICU, we don't have to wear the PPE that they talk about in the COVID zone, like N95. We wear a surgical mask, and sometimes we don't have enough, and we just call down somewhere and they magically appear. So that's really great too. But I do keep my mask on. I wear the same mask for pretty much the whole shift, unless it becomes soiled or it's too wet, and I replace it. So, I wore 3 masks the last time I was there in the non-COVID unit, and I felt kind of guilty for changing my mask, but it had to be done. And now they're pink. They're not blue anymore, and they're a hot commodity. Everybody wants to wear a pink surgical mask. We've never seen them before.
They're the Chinese variety? They're pink?
No, they're, well, I don't know where they're made, but they're, they actually, they feel like they fit better than the blue ones too. That's right. Well, it's something to look forward to. I'm going to put on a pink mask this morning. Yoo-hoo! Even the guys want to wear them.
Are you seeing a decline in the patients that are coming in?
Of the COVID patients or the regular patients?
Well, actually, let's do both those questions because I'm curious because there's been such a scare in older people going to the hospital in general. So maybe the non-COVID, and then I'd love to hear about the COVID too, please.
Well, because of the public health orders to stay apart, we are seeing less patients, period, because we just are we're not infecting each other with regular virus like flu and cold, RSV, because we are staying apart. But regular infection is being treated in the community a lot of times, and because the elective surgeries were canceled for that 3-week period, it seems that we are not seeing regular admissions to the ICU, but people are still falling off ladders and hitting their heads when they're on their bikes, this sort of thing. So we are seeing those patients on the same kind of level as we were before, as in the adult ICU. In the COVID unit, we are not seeing. We're seeing like a chronic number, like that we're not getting like one night we won't have like 20 admissions into the COVID unit. It might be every 3 or 4 days we have a couple of admissions. So it's very slow. People seem to be holding their own, and the way the physicians are managing them, we're not going for early intubation. We want people to breathe on their own for as long as they can. And because we are not overwhelmed, it means that we can give every patient individualized treatment, and there is enough people to look after them as their needs arise. So they might be in observation areas on a couple of nasal, like a couple of liters of oxygen, but as their situation worsens or gets better, then we have the right people on hand all the time to give them more oxygen, and if they need to go on a breathing tube, we can do that. And that is the difference between what we were seeing in other countries and here, because the numbers are actually lower, and every day it gets lower and lower. We are able to tailor our treatments specifically for that patient's needs, which is a huge bonus for everyone. We all will benefit from that.
That's amazing. And what surprised me is the variety of symptoms that are out there. At the beginning, it was very limited, and now we're seeing, you lost taste and smell, and kids are having purple toes, and such a difference. Have you seen all those types of symptoms, and have you seen people that come in that you would never have thought had COVID that did, and some that you were surprised tested negative?
Well, that's the diagnostic part is not my area it's not my scope of practice. But my husband is an emergency room doctor in a different hospital in a different city, and he has tested lots and lots and lots of people, but only one of them was positive, and had the symptom was a lack of smell and taste. So the people that I see coming into the ICU are people who just can't breathe. They just are tired of breathing. They've been working with this for maybe 2 days. Some of them have been working for 10 days to try and breathe, and they just can't anymore. The damage to their lungs is too significant. So I can't really answer that question the way you'd like me to, but I think that what's important is that this is a new virus. There's always been a corona-like virus around. It's a family of viruses, but this one in particular seems to be doing different things to different people, and so we can't really know why there's such a variation in symptoms, and also the people who are telling us what the official symptoms are also people who depend on the luxury of empirical evidence. And until we have enough people who test in positive and can describe their symptoms then we won't have a proper data set on what the symptoms are. So people do have different symptoms. I was listening to somebody's blog last night, and they were talking about how diarrhea actually is maybe a symptom of COVID because of the what they call a cytokine storm. It's an inflammatory process storm that happens to some people, and it affects their guts, but not in everybody. So that's why they just don't have enough data yet to tell us what the real symptoms are. But anecdotally, people will tell you, I had diarrhea, or I had a sore throat, or I couldn't smell and taste. And initially, they were saying that that's not one of the symptoms, but now they are saying it is. So as the virus unfolds, and we see how it manifests itself in different people, then we are going to see this variation in symptoms.
So, and as we start to kind of open up a little bit, what are those 3 things you want us all to keep doing?
I want us to keep listening to the health officials to tell us what we can and can't do, and to stick with that plan. There's a kind of an impatience to get back to normal, which I even feel. I have kids at home too. I want them to go back to school. I want all that. But I think that we really have to listen to the health officials. I'm acutely aware of how our physical distancing has affected people's businesses, and they're unemployed. Students aren't getting jobs. University kids aren't back to school. I want all that for them, but I really feel that it's time now to be cautious about moving forward. The virus isn't going to go away the longer we are apart from each other, but we're going to see a trickle effect. And so we want to be able to manage everyone who gets sick if they need to be in hospital. The majority of people don't seem to be in hospital, and the majority of people aren't dying at home who get the symptoms, which is a good sign. So I want people to listen to the health officials and do what they say. I think it's a really good idea to keep washing your hands, have the hand sanitizer in the car. So there's no reason why you can't use soap and water. It works just as well and maybe better, because you have to, and include rubbing your thumbs when you are using the hand sanitizer. And it seems like wearing a mask is a really good idea. The science is kind of confusing. It says to, wear your mask stops the virus from like spraying out of your mouth, but it doesn't actually stop you from getting it coming back in, like breathing in the air. But if there's less virus in the air around you, like on your shopping cart or surfaces, then there's less viral load to infect you. So I think that seems to be the 3 things. Like, listen to the health authorities, do what they say, wash your hands really well, and wear a mask.
What do you think the silver lining will be in all this, especially as it made your nursing staff so cohesive? And I feel like the health workers have risen to superhero status, and it's going to carry on, I think.
Yeah, I guess I'm in the middle of it, so I don't feel like a superhero. I see other people as being superheroes in the work that they're doing. I think that this is what we've always done, but now we're being asked to do it more often and with more people. Thankfully, we haven't had to do that here, but in other parts of the world, those are the superheroes who, they work, they don't have lunch, they can't pee, they just can't do anything. They can only work, and they do. So my silver lining would be that this virus takes its course, doesn't take very many more lives if we can avoid it with our physical distancing and hand washing, and that our kids get back to school, and that our grandparents get to be free. I guess I'm a bit emotional about that, but we could get back to normal again. That would be the silver lining, that we could do that by maybe September, October. But it all just depends on what we do. If we want to be reckless and meet in large groups and take risks, accept the fact that you're taking a risk, but it means that you're putting a huge burden on the healthcare system if you get sick, because you just don't know how this virus is going to react in your body. But the silver lining would be that we get back to normal with time.